Directive 61 actually originated from, again, information coming out of Quebec and the research that's being done by the various scientists and medical professionals in that area. And they gave a directive to healthcare facilities in the province of Quebec that anybody working closely with the most vulnerable people in our society, mainly 70 plus immunosuppressed or people in special categories, either have to show proof of vaccination or be screened 3 times a week, for COVID-19. That directive came down initially through the hospital, and they are mandated, to do so as a profession. But it was discussed as a local directive as well, and looking at all the science and the rationale behind it, we agree that it's something that we should put in effect, within the community. We have people outside the scope of just the hospital who work directly with clientele who are the vulnerable clientele, and not just in passing. They could be in contact with them for an extended period of time, on a regular basis. So we felt that as additional level of protection to the clients receiving the services, that we would implement this screening as well. The primary purpose of it is to ensure that asymptomatic spread is caught. If somebody, as we know somebody could have COVID-19 in the early stages and not show any symptoms, but still be able to spread the virus, or have very minimal symptoms and be able to spread the virus. The vaccine has shown to drastically reduce asymptomatic spread. In the absence of a vaccine, the alternative is to be screened 3 times a week, and to ensure that if you have COVID and not showing symptoms, that you are not inadvertently spreading it to somebody who could be very vulnerable. Right now, it's the same PCR test, and so basically it's the nasal swab that's going to be used for now, anyways. I know it's uncomfortable, and it's not a pleasurable experience. But again, it's about making sure that we're keeping the most vulnerable people safe. And it's a compromise because we respect the fact that people do not want to get vaccinated for whatever reason. But again, the clients receiving the services also have a right, to be able to feel safe when a community service is being provided to them.
What we see coming in the future is something like it's called the spit test. So it's a bit definitely less intrusive. We don't have a timeline. We're waiting for it to be implemented across Quebec. So our team has received training, as well as Montérégie testing sites. However, we haven't received all of the materials yet to be able to implement. So we're not sure when that's going to happen, but we know that it's coming, and only for systematic screenings, not for the regular tests, because the spit tests are not as sensitive as a regular PCR test, and therefore we wouldn't use it for regular testing of somebody with symptoms. And they have to be used only in certain ways under certain circumstances. So the fact that we're screening 3 times a week makes them a good choice, a less invasive choice. So we'll hopefully be implementing that soon.
We initially received a concern raised about a week and a half ago, by the Longhouse, and they felt it was an infringement on individual rights to have people screened 3 times a week. In their words, a means of coercion, I guess, to be able to get people to get vaccinated. No, that's acknowledged. I mean, that could be a view, but that's not the case whatsoever. It's based on scientific data saying that minimize the risk of asymptomatic spread is the reason why it was looked at and accepted. I respect everybody's opinion. I mean, and they do sit here at the task force as a representative, and his concerns were raised. We had some discussion. We had a lengthy discussion on it. End of the day, it still felt that it's important to implement, again, for the collective of our community. Add to that the 4 organizations that are impacted. It's over and above the task force. It's an employee-employer related aspect. So Kahnawake Hospital, has their authorities, and they have to implement certain elements, or have to implement Directive 61. The peacekeepers as well, and all their staff have been vaccinated or scheduled to be vaccinated. So that's almost like a moot point for them. KFB paramedics are identified in there as well. Again, all of them have been vaccinated, as well as I think medical transportation. And speaking with Fire Chief David Scott, he did speak to his staff, and he had no major concerns from them. They had agreed to be screened, and know there may have even been some people who agreed to be vaccinated. But again, nobody's being forced to. there are options. And then obviously in the hospital setting, it's different, and also with the KSCS, mainly with the Elders Lodge and ILC. We always said those are the most vulnerable in our community. So these measures are in place, with the support of all these organizations. It's a task force responsibility, but also on an employer related at these organizations, there's also a responsibility there to protect our community.